Good afternoon, everybody. Dr. Michael Jacobs here at the Fertility and IVF Center in Miami. Today's Instagram chat talk is basically uterine cavity assessment, endometrial assessment. What is it, why is it important, and how is it getting done? As most of you know, to be successful in getting pregnant, we need sperm, eggs, the formation of embryos, and a nice healthy place for the embryo to develop. So knowing that the uterus is normal is an extremely important part of the diagnostic evaluation and management of a couple having infertility. The simple way when first present to the office to examine the uterus and get a general idea of what's going on is obviously a pelvic examination that tells us the uterus feels normal in size and shape, and a standard ultrasound that tells us if there's any obvious large myometrial abnormalities like fibroids or adenomyosis, etc. What it doesn't do, though, is to give us a good idea of what the interior of the cavity looks like. And the interior of the cavity is very important because that's where the embryo is going to stick. So if there's a structural abnormality, scar tissue, an endometrial polyp, an endometrial fibroid, a congenital variation in the shape of the uterus, none of that's really going to show up with just a standard pelvic ultrasound. So there are a couple different ways that we go about evaluating the inside of the cavity, and it's an evaluation that needs to be done in any patient having IVF, or preferably any patient undergoing infertility assessment. Traditionally, a radiologic procedure called a hysterosalpingogram was used, and the hysterosalpingogram is mostly thought of as telling us if the tubes are open or not, because what's done is some dye, radio opaque dye, is injected into the cervix, and using fluoroscopy, a series of pictures are taken that show the dye filling the cavity, filling the tubes, and the dye spilling out the tubes to tell us if the tubes are okay. And as long as this is done with appropriate technique, where the little balloon catheter that you use to inject the dye is not causing a visual obstruction in the cavity of the uterus, you can get a pretty good evaluation of the uterine cavity at the same time. So particularly in patients where we're doing just a basic evaluation of why aren't you getting pregnant, or in patients who need to document tubal patency if we're planning intrauterine inseminations, for instance, or to need to rule out a hydrosalpinx, a dilated tube, then a hysterosalpingogram is a really good test that gives us both some information about the cavity of the uterus as well as information about whether the tubes are open or not. The second possible way of looking at the inside of the uterus is by doing what's called a saline infusion ultrasound. And this is no different than a regular transvaginal ultrasound, with the exception that a catheter is placed in the lower portion of the uterus, a cervical canal, and a small amount of saline is used as contrast so that when you do the ultrasound, you can see if there's a normal shape to the uterus. So just like the hysterosalpingogram, it's giving us a general idea of the shape of the uterus, if there's a filling defect, if there's something that's preventing that dye from looking like a solid painting in it. And both the saline infusion sonogram and hysterosalpingogram give us the same basic indirect information that the cavity is normal or there's something in the cavity that needs further evaluation. The third method of looking at the inside of the cavity, which is our preferred method when we don't need to know about the fallopian tubes, is called an office hysteroscopy. And hysteroscopy, you break it down, hyster is the uterus basically, and oscopy just means to look. So we're going to look inside the uterus. And by using a little 3mm flexible fiber optic telescope, and the saline is the stenting media, we can actually advance the end of the telescope that has a little camera on it, and you do this under video so you can see as well as we can, and look at the cervical canal and inside of the uterine cavity to see if there are any focal abnormalities. So the difference mostly between the HSG and the saline infusion sonogram and a hysteroscopy is with the hysteroscopy, you're using your eye, you're looking directly at something, whereas with the other two types of imaging, you know it is a defect there. There's something there that's not normal, but you don't know what it is, whereas when you're looking at it directly, you get a much better appreciation that there's an abnormality, plus you know what it is. Usually you can tell the difference between a polyp and a fibroid. You can certainly tell the difference between a scar tissue and an endometrial polyp. You can tell if the cavity has a normal shape or has a septum or a wall dividing the cavity into two, etc. From the practical side, each of these tests are equally valid at particularly when they're normal, to proceed with treatment. So they're interchangeable. You don't need to have all three of them. If the main thing we're interested in is the uterine cavity, any of these three tests are okay. Our personal preference, my personal preference particularly, is to do the office hysteroscopy. And the reason is, one, if you find something, you know what it is, so you know the best way to counsel the patient. And two, you can often see some things that you might not see on the hysterosalpingogram or saline infusion sonogram. With that is whether you see things that are suggestive of adenomyosis or inflammation, chronic inflammation, where you see general redness of the lining and so forth, can relate to both infertility and miscarriage, failed implantation. So in my mind, hysteroscopy is the better of the three tests, but we don't, if you've had a recent hysterosalpingogram or saline infusion sonogram, that's more than adequate. And similarly, for some patients who come from out of the country, they might not have the availability of all these different assets, and it does not, it's not justified to take a patient to an operating room to do a hysteroscopy to find out the answer, because both saline infusion sonogram is a simple office procedure, hysterosalpingogram is a simple office radiologic procedure, and hysteroscopy, at least in our hands with flexible small telescopes, can also be done in the office where you don't need any specific anesthesia. So that's just a short, brief summary of today's topic. To summarize, the integrity of the uterine cavity is an important factor to know in any fertility couple, particularly any patient undergoing in vitro fertilization or having an evaluation for failed implantation or recurrent miscarriage. The three ways to evaluate it are hysterosalpingogram, saline infusion ultrasound, or office flexible hysteroscopy. I hope that was helpful. A nice short talk today. Wish everybody well and have a great afternoon. Bye-bye.